to the Everything Wellness Podcast. I'm your host, Mark Dionisio. I'm the wellness manager here for St. Lucie County Public Schools. And, every month we talk about a different wellness topic. And this particular month, I want to discuss oral health and oral hygiene and the importance of it. So who better to discuss this with than Dr. Plains from Plains Dental. So Dr. Plains, thank you for joining us today.
Thank you.
It's a pleasure having you.
I'm privileged to be here. Thank you so much.
So if you can just kind of give an introduction of yourself and your business and what you do here in St. Lucie County.
Absolutely. So we currently have 4 dental practices here in St. Lucie County. We're servicing, and Indian River County, I apologize, with Vero Beach, Port St. Lucie East, right on US 1, and 2 offices in Tradition. We have a general and cosmetic practice right next to the Jersey Mike's, right by the hospital.
Oh, yeah.
As well as our new Implants for All Center, which will be offering full arch dentistry with lab services, as well as eventually interventional medicine.
Awesome. Awesome. So we're going to jump into the topic of oral health and why it's important, right? So why is maintaining good oral health, hygiene essential for overall health in general? Like, what would you say?
It's so important because I personally believe that the American Dental Association doesn't do a great job advocating and showing to the human population about the importance of oral health, for example, because that is the entry to your soul, the entry to your health.
I like that.
So, everyone has a disconnect that, oh, my tooth is hurting or I have an infection, and they don't think that that infection is spreading to other parts of the body. I would have to tell you, Mark, that out of 10 patients that have a heart attack, 9 of them have a dental infection of some point of their life or already have one presently in their mouth.
I see. It's interesting you say that because my next question actually had to do with, when it comes to poor health and, how does it contribute to certain diseases such as heart disease or diabetes, right?
Yeah.
So, how can poor oral health actually contribute to those? Like, what would be some of the risk factors when it comes to poor oral hygiene that would lead to some of those diseases?
Yeah, so when you do your radiographs and your examinations and you evaluate for infections or gum disease, something as easy as gingivitis, you're getting that bacteria in your health. It's going through your bloodstream. So we have, bone, and there's blood always transmitting or flowing through the areas of the teeth, right? So that bacteria is actually going to your heart, it's going to your stomach, your pancreas, and your kidneys.
That's not good.
So like I was saying previously, a lot of the patients that have had heart attack or need heart replacements or have mitral valve issues is because of teeth infections and dental neglect of not going to the dentist at least every 6 months.
Wow. See, and I never knew that, as far as, what other health issues can actually come about from having poor oral hygiene, right? What are some of the more effective daily habits that somebody could do to prevent cavities and gum disease? I mean, obviously, we know not to have a lot of sugar, right? We've been taught that since we were a kid, but what would you say?
Well, I've seen a high incidence of dental decay, especially in some areas, since I worked from Vero Beach to St. Lucie, and at some points I had a practice in Orlando. And it all depends on hygiene. How many times do you floss a day? You should at least be flossing once a day and brushing at least 2 to 3 times a day after every meal. But there's patients that think that just by doing that, they're okay, and they don't have to go to the dentist. It is very important that you go to your local dentist at least every 6 months and you have at least an annual checkup.
Yeah, and that actually leads me into my next question, is that even if some type of issue isn't visible or pain or something like that, people think that, oh, maybe if I just go to the dentist once a year, that's fine. But, explain a little bit more in depth why it's important to go to the dentist regularly.
Yeah, of course. Like, for example, prime example, yesterday I had a patient. She had a huge infection in one of her anterior teeth. No pain, no discomfort. If we don't take the necessary radiographs and x-rays in order to evaluate and have a professional doctor look at it, that infection will spread and continue to affect the adjacent teeth. And sometimes patients are like, Dr. Plains, but I have no pain. And you don't need to have pain. When a tooth becomes necrotic, you might have a little bit of discomfort for a little period of time. You take, some ibuprofen, antibiotics, pain goes away. Then all of a sudden, you're like, I'm fine. Months go by, years go by.
And you have no clue.
And you have no clue. And then you go to your dentist, and your dentist is like, I have, the infection is spread. And they're like, that's impossible. But it does happen all the time.
Yeah, and I've heard that before, going to the dentist. Basically, it's almost like the tooth dies, for example. And then you don't experience the pain, and you don't realize the the bad side effects that are actually happening and going on within the mouth. So yeah, that makes sense. Now, like I said before, we've all been taught and told since we were kids, don't eat so much sugar, you're going to get cavities. Can you kind of go into that a little bit deeper? And, you know, how does diet, especially with sugar, how does that impact your oral health?
It's so important, Mark, because, like, for example, everyone nowadays is drinking high sugary drinks.
Oh, yeah.
You know, our kids are drinking Coke, they're drinking Mountain Dew, Dr. Pepper. You know, my kid the other day, I have 3 boys. They had a sip of Mountain Dew and they immediately became addicted to it because it's pure sugar. So that all, you know, those habits eventually start coming at you, you know, through dental decay. I know so many people that just drink energy drinks and they're not evaluating the fact that you know, the chemicals cause erosion in your teeth.
Absolutely.
Which eventually will weaken your teeth and cause, you know, fractures or cavities or bigger issues in the long run.
Interesting. Yes, yeah. Again, these are things that even I'm not aware of when it comes to certain energy drinks. You know, you get the ones that say 0 sugar,
but you still have the chemicals.
But you still have the chemicals in there that could be causing some issues as well. Now, you know, when it comes to oral health as well, a lot of people coincide that with having bad breath, right? But we know that can come from your stomach, it can come from certain other issues. Bad breath, clinically known as halitosis,
Yes.
right? So why is it that brushing regularly and flossing and whatnot, why would that help? Obviously, you have not bad breath.
It definitely helps, but like you said, there's patients that can't control it. You know, there's patients that brush and floss and they still have bad breath.
Yeah.
A lot of times things are also, unfortunately, due to genetics. Like, you know, there's patients that lose all their teeth at the age of 40, 45 because, you know, their dad or their mom had, you know, periodontal disease, and it's something that they control. But it's so crazy that sometimes patients that lose all their teeth, they don't even have one cavity. And then there's patients that brush and floss and clean and everything. They have strong bone, but they get cavities everywhere. So there's a lot that has to do with the microbiology of your bacteria in your mouth and whatnot. But back to your question, if you know, patients brush, but a lot of the time, if they're not flossing, you still have that bacteria that is still sitting in between your teeth and it's still inside your gums, which will cause bad breath.
Yeah. Now, I've been taught also, too, when brushing your teeth, to also brush the gums as well.
Yes.
To kind of harden the gums, make them a little bit more healthier. It cleans out, obviously, some of the stuff that could get, you know, lodged under there. And that was something, for me, actually, growing up. I was not the best with my dental health, I'm not going to lie, but most kids aren't as they're growing up. And I remember that I needed a deep cleaning because, again, it started developing a little halitosis. And, you know, just my teeth weren't that straight and whatnot. So I was like, okay. And obviously, when your teeth aren't that straight, it's harder to clean in certain areas, right? So things kind of build up and kind of go that route. But I've noticed once brushing my gums and flossing, and that they're a lot healthier. The color comes back. They're not that dark red color. They're more that nice, healthy pink color. So now, regularly, I go to the dentist and get my cleanings and my procedures and whatnot. And, man, it's made a total difference.
It's total difference.
It really has. I'm going to kind of switch gears and talk about, you know, how dental health can actually impact your confidence and your mental health, right? I mean, just kind of using myself as an example, I had mentioned before we started recording, about 2 years ago now, I'm still on them. I just got an Invisalign. You know, growing up, like I said, my teeth were a little crooked, but I didn't want braces as a kid. I just thought it didn't look right, and I just wasn't comfortable with it. And I didn't care that I had 2 teeth in one spot. It was a little off.
It's so funny you say that. This is kind of off topic, but when I actually, I didn't need braces, but I wanted braces because all the cool kids had braces. So I was like, Mom, are you sure I don't need braces? They're the one getting all the girls, you know? So it's kind of funny, but go ahead, sorry.
Yeah, complete opposite when, you know, when I was growing up. I don't know how much of an age difference we have, but completely different. So for me, I was like, you know what? I recently got married last year. And
congratulations.
Thank you very much. I appreciate that. And for me, you know, I wasn't confident smiling because I knew that some of my teeth were crooked. And, you know, for me, I was like, you know, I think this would be the good time to get my teeth fixed and straightened. This way, when it came to my wedding photos, I can smile and be happy and not, you know, putting on that blue steel face or whatever, looking at the camera. Wanted to, you know, be able to smile and enjoy and have nice pictures. And let me tell you, it really boosted my confidence in that aspect. And not only that, I saw how when my teeth were straightening, how I was able to clean them a lot better. And, you know, again, mentioning my gums got stronger, the bad breath that started to form went away. All my health markers when it came to oral health were just constantly, every time I went, were getting better and better and better over time. And it's probably one of the better decisions I've ever made in my life is getting the Invisalign.
Yes.
So how, from your practice or from any examples that you have, how do you see the confidence and the mental health being impacted?
Oh, it's huge. It's huge. Unfortunately, dental insurances don't cover a lot. So a lot of patients, neglect their oral care. Yeah. So there's a lot of people that don't want to can't even apply for jobs because they're covering their faces, they're missing teeth. This dental epidemic is huge. I do full arches, a lot of full mouth reconstruction. Yeah. Studies show that 65% of the world population at one point or another is going to need a full mouth reconstruction.
Oh, wow.
So we need to figure out a way to support the communities and help dentists, help the population, and have other dentists on board to support the local communities. Yeah. We run an institute here out of Port St. Lucie, where we train doctors in the state of Florida on implant surgeries.
Oh, nice.
So in the last 3 years, we've been able to give over 150 new smiles to the local community. So it's a way of giving back. We're training the doctors, and we're actually changing people's lives.
That's awesome.
As in the process. So
that's really awesome.
So I'm proud to say that because I come from very humble beginnings. Yeah. My grandmother had dentures at the age of 23.
Oh, wow.
She got all her teeth taken out in Cuba because she couldn't afford. To get them fixed.
Yeah.
So like back to what you were saying, it's very important that your oral care gets taken care of. Yeah. We offer promotions, for patients to come in, consultations. So I know everyone hates the dentist, but we're not bad people. We want to help you. But last week alone, a young girl, she got in an accident. She was 34 years old. She lost all her front teeth. Wow. So she couldn't get a job. She couldn't, apply anywhere. Couldn't get in a relationship. Yeah. We gave her a full set of implants, and she's as happy as can be.
Oh, I can imagine. Yeah.
Another patient in Orlando, she was a victim of domestic abuse. So she had very, very low confidence. Sure. She lost all her teeth because her husband will beat her, unfortunately. And in 48 hours, we gave her a new smile, and now she's dating somebody, and she's smiling everywhere. And if you look at her social media, all she does is smile.
That's awesome.
So it's so important, that a lot of people in their psychology are affected by missing teeth or by teeth that are going bad.
Absolutely. And not only that, it even affects nutrition if you think about it, because if you have pain or poor dental health, you can't eat certain foods, so you avoid certain things, and instead of going and get the care that you need, well, now you're being, malnutritioned in certain aspects because you're not eating the proper food.
And I love you say that, Mark, because when patients come in and they're like, I want a beautiful smile, I want to have a smile like the white teeth, but my most important thing, I always tell my patients, the most important thing is function, because you need to be able to eat your food, grind up your food, take care of your all overall, rather than just having beautiful teeth.
Yes, absolutely. Now, obviously, we want beautiful teeth, but we also want healthy gums.
Yes.
Right? So when it comes to the gums, usually some of the issues that we look for is gum disease, right? It's probably one of the main ones. What would be some of the early signs of gum disease for somebody who, again, might not be very aware of their oral health? What would they look for?
That's a great question. So one of the first signs you're going to see is puffiness. When you brush, you bleed. Yes. When you floss, you bleed that darker red blood. Yes. And, you feel that bad breath that doesn't kind of go away. But one of the biggest signs you see is around the gum line, you see like the margins around the teeth are darker red and the rest is pink. So that is immediate gum inflammation that's occurring right away.
Wow. Okay, so that's definitely something to look for, of course, bleeding gums. What about somebody who smokes, right? I think the smoking population has gone down since at least I grew up. Yes. When I grew up, everybody was smoking. My mom, my dad, my aunt, the whole family was smoking. But obviously that population, I feel, has gone down. We're a lot more aware of how tobacco, nicotine, and cigarettes affect especially our gum health and overall health in general.
Exactly.
But why would it be more important for somebody who is smoking to be more aware of their oral health?
Well, one of the main things I want to bring up. We've done studies in dentistry and journals, and there's never a patient that has smoked throughout their whole life that is not missing at least one of their teeth.
That makes sense.
It's very, very important. You know, the products, the chemicals, they really do cause a lot of bone loss and a lot of prevalence to dental infections. So it's extremely important that you go and get your checkup. Another big reason you should be going to the dentist is to evaluate possible oral cancer. You know, when you smoke, you have a high prevalence to get oral cancer.
And also, too, what about somebody who chews tobacco? I feel like that would be worse because it's literally just sitting on your gums, sitting on your teeth.
Yes.
What would you say with that? Would you say that would be more impactful or less impactful than?
It was more impactful.
Yeah,
for sure. As we know, a lot of the baseball players back in the in the 80s and 90s got oral cancer because of the chewing tobacco.
Is that what it was? I thought it was the shredded bubble gum they used to sell in the pack. Remember that stuff?
Yeah. I love that bubble
Yeah,
gum
it was good, yeah.
It just makes you feel like you're going to hit the ball harder.
It does. It definitely does.
So you got to, go in at least every 6 months. It's not a lot to ask for. You go in for 6 months, you get your radiograph, you meet your hygienist, and you talk to your doctor at least once a year about what is going on.
Absolutely. Absolutely. And obviously, paying attention to your oral care is going to it's going to just enhance your overall wellness and well-being in general, right?
Yes, absolutely.
Because like we said, we touched on it, it even affects nutrition, it affects mental health, it affects, even social. I mean, if you have bad breath, you're not going to want to go out and talk to people.
Yes.
You're going to be shy if you're missing teeth, So, how would you say, in your opinion, why that oral health, just impacts overall health? Like, give me some examples of that.
Well, for example, let's just start with gum disease. As we talked previously, you have an infection that is in your bloodstream that can affect your heart. 9 out of 10 patients that I've treated, I asked them, not even looking at anything, just looking at their radiographs, not even at their medical history, I asked them, have you ever had any heart issues? They say yes. A lot of them, high blood pressure, which is huge.
Yeah.
What happens when you get on high blood pressure medications? Then you have low salivary flow.
Yeah.
What happens when you have low salivary flow? You're more prone to get cavities around your gum lines. So that's all very important that people evaluate that and understand that it's just not one thing. It just trickles down to other factors.
It's a snowball effect.
It's a snowball
basically.
effect,
Yeah.
exactly.
Very interesting.
Exactly. And then the confidence, you lose that confidence. You're afraid to apply for your dream job. You're afraid to, ask the woman of your dream out on a date because you're, covering your mouth.
Yeah.
And a lot of times, we do a lot of consultations for dental implants and general dentistry.
Yeah.
And you think the patient is just really unhappy being there, but it's not the case. A lot of times is that the patient just doesn't have the confidence and is kind of upset of the situation that they're in.
I mean, I would say that too. Like for me, once I decided, okay, I need to really pay attention to my teeth and my gums and my oral health, I look forward to going, to be honest with you. The only thing I don't look forward to, and I'm just going to be 100% honest, is with the Invisalign, every once in a while they got to shave in between the teeth.
The interproximal reduction.
Goodness.
Yes.
It's not the feeling, it's the sound inside your head that gets me. But other than that, again, best decision I ever made. I mean, seriously, looking after and taking care of your oral health to me is tremendous because, again, it affects so many other things in your life. And it's very important. And of course, we don't want to be sick.
Of course, you know. And one more thing I would like to bring up that's extremely important. People are going to be like, but Dr. Plains, I'm super afraid of going to see you. We have a lot of different options now. Like we can give you oral sedation. We can do nitrous. We can do IV sedation. So we don't want patients to feel like they can't come in because of fear, because we have the tools necessary to be able to support those patients.
Yeah, and that's really important to know.
I think it's everything when a patient sees a smile for the first time. When they actually see their smile for the first time, number one, they get more confidence. Number two, they're able to go to a restaurant and eat the things they want to eat, and I look on the menu and say, wow, I can't eat certain things. How do we help somebody feel more comfortable when they're coming in our process? What do we actually do in those steps? It's very simple. We focus on the end goal, the end destination. Obviously, as so many people don't go to the dentist because they have fear, and that leads to neglect on their actual oral health. So what we actually do is help them focus on their end goal and help them really see what the outcome can be. Hey, look, this is what we're going to do. We're going to show you from step A to B, and we're going to walk you through your hand. And we also have a lot of different options for patients to feel more comfortable. Even if they're not wanting to be awake during that, we offer sedation options and many, many other things to help them feel more comfortable. I think it's the greatest joy in the world when we actually get to see, somebody's smile transformation. I think it's, phenomenal, and be able to see somebody's spouse with them, and those moments are truly incredible. So, what we like to do, we like to be with them there during that entire process, and I love to hand somebody a mirror so that way they can see the smile for the first time and really, really dive into what this can do for them.
Speaking of Plains Dental, tell me about your business. Tell me about what you guys do there, and tell me about what you do in St. Lucie County.
Absolutely. So, we're a group practice. So we have associates and myself when we support the local communities. We do general, cosmetic, and implant dentistry.
Okay.
We see patients as young as 3 all the way to 100.
Nice.
So, we have doctors to support with root canals, implants, Botox, cosmetics, veneers, smile makeovers, dental implants, extractions. So we take care of every avenue in dentistry. There's very few things that we refer out, and if we have to refer something out, we have a group of local specialists that we work with they're all amazing.
Great.
So we support the school board by giving them, extra privileges by coming to see us. You get the additional discounts. You get privilege of coming in sooner in regards to your dental checkups and overall dental care,
That's
as well
fantastic.
as major discounts if you don't have insurance.
That's fantastic. Do you have anything going on that's upcoming that you want to mention? Or?
We always have it. We always have things going on. You just got to call our office or visit us at plainsdentalarts.com and visit one of your local offices by you.
Perfect. Do you do teeth whitening?
Yes, we do teeth whitening.
Okay, good. Because after these things come out, I'm coming in to do some
Awesome.
teeth
Yes, we
whitening
do.
for sure.
We do Zoom. So there's 2 ways of doing teeth whitening. You
Okay.
can do in-house and you can do take-homes. So when you do the in-house, you get that effect right away.
Yeah.
And then I recommend patients to get the trays to do it at home. And for members of the school boards, once they become an established patient and we know everything is good, we give patients free take-home whitenings.
Beautiful.
Yes.
Beautiful. Well, that's fantastic. Listen, thank you so much for joining
thank
me
you.
today.
It's a privilege.
It's been an honor. And
We can go on, hours talking about dental
seriously.
care.
Yeah, no, seriously. I mean, it is really an important topic, and if you're on the fence about getting your teeth and your oral health taken care of, trust me, for someone who didn't like the dentist growing up, I enjoy going now. I love it. It was one of the best decisions I ever made. And Dr. Plains here, he's fantastic for the county, and he's ready to help all of you guys.
Yeah, and I
out
look
there.
forward to continue to help the local communities with new smile makeovers. So super pumped about it. Thank you, Mark.
Thank you so much.
Thank you.
It's been a pleasure.
Appreciate it.
Thank you.
Likewise. Thank you.